afternoon, namaste, and sadar pranam to all the dignitaries, GB member of RAB, and all the Gurujans. मैं डॉक्टर खुशबू पांडे आप सभी का इस वीकली वेबिनार सीरीज ज्ञान गंगा में स्वागत करती हूँ। जैसा कि आप सभी को पता है कि पिछले 3 वर्षों से यह सीरीज निरंतर चलती आ रही है। उसी कड़ी में यह इसका 178 एपिसोड है, जिसमें हमारे गुरु और गेस्ट स्पीकर डॉक्टर उपेंद्र दीक्षित सर हैं, जिनका टॉपिक है कैंसर इन आयुर्वेदिक एस्पेक्ट। Before beginning the session, I would like to welcome and heartfelt gratitude to our mentor, Padma Bhushan Vaidya Sri Devendra Triguna ji, President of Governing Body RAB, Vaidya Rajesh Kotecha Sir, Secretary Ministry of Ayush, respected Dr. Vandana Siroha Madam, Director RAB, who had been always there to guide us, motivate and encourage us for sustenance of this series. Before beginning the series, I would like to short identification of Dr. Upendra Dikshit sir. Professor Vaidya Upendra Digambar Dikshit sir, currently sir Chief Consultant at Dikshit Ayurveda, Goa. Sir has esteemed CRAB Guru, work as member of Higher Education Committee for Implementation of New Education Policy appointed by the Government of Goa. Member of editorial board in New International Editor of Charak Samhita. Sir has done his BMS Pune in Pune University, MD in Jamnagar, PhD in Pune University, MA Sanskrit in Tilak Maharashtra Vidyapith. Sir have 24 years of UG teaching experience, 10 years of PG teaching experience, 24 years of teaching experience in Samhita Siddhant, especially Charak Samhita, ex-professor and HOD, Department of Basic Principle of Ayurveda, Gomantak Ayurveda Mahavidyalaya and Research Center, Goa. Work as member of Board of Studies for Ayurveda at Goa University for 14 years. Apart from teaching in college, encouraged and guided many students to practice Ayurveda, regularly conducting lectures to improve their clinical knowledge. Sir have 29 years of clinical experience. Apart from chronic disease, treated many acute conditions and also treated more than 192 critical patients in various ICUs of hospital in Goa. Sir has received prestigious award, Sindhu Ayurved Bhushan Award, Hari Om Gold Medal, Karya Bhushan Award, Vaidya Purushottam Shastri Nanal Memorial Charak Award, Dhanvantri Award, Gamma Legend Award, honored as Successful Doctor of Ayurveda, received Best Outstanding Student Award, honored at the hands of then Chief Minister of Goa, Mr. Manohar Parrikar. Sir delivered more than 192 guest lectures. Sir has done tremendous work in Ayurveda. I wholeheartedly welcome you, sir. Please take the session forward with the blessing of Lord Dhanvantari.
Yes.
जी सर आप
फुल स्क्रीन दिखाई दे रहा है ना?
Yes sir, screen is visible.
Yes. So respected Padma Shri Padma Bhushan Vaidya Devendra Triguna ji, who is the motivating force for all the activities of RAB. Respected Vaidya Manoj Nesri sir, respected Vandana Siroha madam, who are inspiration for all the activities. All the respected Guru and all the studious students of RAB. My today's topic is cancer in Ayurvedic perspective. So first of all, the question arises that whether cancer is a new disease or it is a specific condition of diseases described in Ayurveda. I was fortunate enough to receive guidance from many stalwarts in Ayurveda. One of them was Vaidya Bhalchandra Purushottam Nanal from Pune. He was then the leading practitioner of Ayurveda in Maharashtra. And he treated thousands of cancer patients. So according to him, the patients who come diagnosed as cancer, their Ayurvedic diagnosis, usually there are 16 diseases as per him, in which these kinds of conditions are observed. So as per him, there are 16 diseases, specific conditions of those diseases, they come as the presentation of cancer in our clinic. So that is one opinion. But when we see the patient, different patients, there are certain patients in whom uh, the samprapti is so much new that it is not exactly described in Ayurvedic texts. So both the opinions.
Sir, mic off हो गया है. Sir, please check your mic is off. Sir, you are not audible. Sir, your mic is off. Sir, am I audible or not?
हेलो सर. हेलो सर, वॉइस नहीं आ रही.
Sir, voice. सर एक बार फिर से एग्जिट करके वापस से ज्वाइन करके देखिए, शायद आवाज आ जाए.
Am I audible now?
Yes, sir. Now you are audible.
Yes. Okay. Okay.
Yes, internet.
Sorry for the interruption. There are heavy rains in Goa, and red alert is declared by IMD. So there is some, I think, internet problem was there. Now it is connected.
Yes, sir.
So we were discussing that uh, Vaidya Bhalchandra Shastri Nanal, who was leading practitioner of Ayurveda in Maharashtra, he was of the opinion that patients who come diagnosed as cancer, they might be having 16 different types of Ayurvedic diagnosis and specific conditions of 16 diseases described in Ayurveda. They come usually as diagnosed as cancer, as per his opinion. But many times uh, we find that the patients are having such samprapti that it is not exactly described in our texts. So sometimes it can be presenting as a new disease also. So ideally, when a patient comes to us, we have to understand the samprapti of that individual patient. And then when we try to understand the samprapti of 10, 20, 50, 100 patients, then we come to know that in this particular cancer, these kinds of samprapti are commonly observed. So this is the way. And that way, I'm going to describe some of the cases who were diagnosed as cancer and what was the Ayurvedic understanding of them, and then how we treated them. But before that, how to understand cancer from Ayurvedic perspective, some guidelines from the text which are useful for that purpose, that we will discuss. So most commonly, Arbud is correlated with cancer, as all of you know. And Arbud is described as you all know that Chiravriddhi Pakam. Pak is not observed in that and keeps on growing. And Mouse Upachay is mainly observed in it. And there are different types of Arbud according to Vataja, Pittaja, Kafaja, Rakta, Mouse, Med, according to that. And different types of in Raktaja Arbud, Ajasra Srav of Rakta is observed, but in not many patients of cancer, this is observed. In certain cases, when it is observed, then we can diagnose it as Rakta Arbud. In Mouse Arbud, I'm not going in details of all the description given about Arbud in the text, but certain points I am highlighting that in Mouse Arbud specifically, it is said that due to Mushti Prahar, etc., that means some sort of injury or pressure, specific kind of pressure on body parts, that leads to development of cancer, and that is practically observed in many patients. So Vaidya R.B. Gokte, who was very well-known expert in the field of Shalya Tantra, he was of the opinion that this is one of the important causes of cancer, that pressure on specifically on a specific part of body or injury to a particular part of the body, and as a reaction of that, what happens, that we will see next. In Arbud, also we observe the description about Adhyarbud or Dvirarbud. And about Dvirarbud, it is said that Dvirarbud is also like Adhyarbud. So Adhyarbud and Dvirarbud. So this kind of concept is like metastasis, what we observe today. So that way also it can be compared with each other. One important aspect is that Arbud is described as Upadrava of Vatarakta. So very famous Vaidya from Maharashtra, Vaidya Samir Jamadagni sir, he's of important reference we should remember. And in many patients, we will find that Vatarakta was the initial diagnosis, and then it turned to Arbud, and then it was diagnosed as cancer. So that's why this Samprapti is also important. So once we understand from Ayurvedic perspective, then only we can decide what kind of treatment we can offer from Ayurvedic side. So that's why all this understanding is important. In Arbud, it is described as Arbudasya Vivardhane Hetava, how Arbud develops or it increases in size. It is said that Ghattana is a pressure, मतलब कसकर बांधना, छिन्न, छेदन, कट, इंजुरी, मृदित, पीड़न, मतलब वहां पर दबाना किसी चीज को, इन सब चीजों से अर्बुद बढ़ता है, ऐसा बताया गया है. So what happens due to आघात or अतिलेखन or पीड़न, घट्टन, मर्दन, Due to this is very important cause in many patients, and that way their samprapti is observed. So we will describe that what will happen if this happens to the body. First is Rakta Dushti takes place. When any such kind of injury takes place, then Rakta Dushti takes place. And further, we are going to learn that Jivan is the karya of Rakta. And Jivan, due to Jivan karya of the Rakta, cells, they are kept alive. But here what happens, that abnormal cells are produced and they are not destroyed easily. So Jivan karya Vikruti is observed in these patients. So Rakta Dushti is very important factor in them. So Jivan karya Vikruti is observed. That's why abnormal cells also keep on surviving. They are not destroyed easily. Then Sarvadayik Shukra and Oj Vikruti takes place due to Aghat. And Sarvadayik Shukra, like Shukra is responsible for reproduction, senior Vaidyas, they are of the opinion that Sarvadayik Shukra is responsible for new generation, that means new formation of cells in the body. So abnormal formation of cells is some way related to Sarvadayik Shukra. Now considering this, some Vaidyas are also using Shukra Shodhan Gan as a part of treatment of cancers in their practice. Then suddenly Dhatukshay takes place due to such injuries, and Dhatukshay-janya Vat Prakop takes place. And this Vat Prakop is Achay Purvak Vat Prakop. That means here there was no Sanchay of Vat, directly Prakop took place. So Prakop is described in Charak Chikitsastan 30th chapter. So that can be observed in these patients when this kind of injury takes place. And then in many patients, Dosh Kshayatmak Samprapti is observed due to such injury. Because of injury, Kshay takes place of the dhatus and even the doshas which are located at that place. And due to such Kshaya, the body is having a tendency that Kshayo Vridhestu Pidana. Kshay is more harmful for the body even than Vriddhi. That is the sutra in text. And that's why the body tries to protect utmost from the doshakshay itself. So that's why if doshakshay takes place, then the body tries to perform udiran of doshas from other places and bring them to this site so that doshakshay can be controlled and the body can be protected from it. So doshakshayatmak samprapti. So sankhya takes place and prakop in that sthana tyag is there, but it happens at the other parts of the body. Sthana tyag of the doshas from other parts of the body, then prasar, and then sthan samshraya at this site where doshakshay has taken place. And there the samprapti takes place. So when there is sthan samshraya, actually there is sthana tyag also of the doshas at other sides and they have come to this site. So many times Ashayapakarsha Gati like is also observed in this patient. So this kind of samprapti takes place in these patients, and if this happens, then the main focus should be on Vat Prakop in these patients. Now in text we find the description about Arbud at different sites. So according to different sites, different Arbud are described in the text, like Karnarbud, Sharkararbud, related to even the genital organs, Nasarbud, Vartmarbud, Mukharog, in that also Arbud is mentioned. Then Oshthagat Jalarbud, Kanthagat Galarbud, Talu Arbud, Mukha Arbud, Kapalagata Shiro Arbud, like that different types of Arbud according to the site of the body which is affected are described. And this kind of description, now when we go to top 5 cancers in men and women in India, then we will find that many of these sites are also the sites of this specific Arbud. So that's why there is some correlation between different Arbud. But in not all the patients, we find the diagnosis as Arbud only. There are other diagnoses also. For example, if there are different types of blood cancers, in them exactly Arbud is not found. Or in many other patients like lymph, in that Arbud is not exactly found. So Arbud is can be correlated with many patients of cancer, but not always Arbud is the diagnosis in Ayurveda. Now, what kind of hetu are observed in these patients? So, at the beginning of the Rasayan Adhyay in Chikitsastan, in Charak Samhita, they have mentioned that Sarve Sharir Dosha Bhavanti Gramya Aharat. And there they have given a list of ahar which should not be done. But nowadays we will find that these are the things which are commonly used in our diet. So Ati Amla Lavan Katuka Kshar, so containing Chinese food. And in our text, Charak Samhita also it is said that Chin, in eastern part of the India and Chinese people, they are eating char more, like that it is told in Charak Samhita. And the same thing is observed today also. So Chinese food, char, then shushka shak, the stored, they are used. All these virudha dhanya, sprouted grains are eaten. So all this list which is given here, they are found commonly used by people these days. And that becomes diva swapna, vishama adhyashana, ati sankshobhit sharir, sankshob. This is also very much observed. So these kinds of observed things are observed. That means ahar and vihar, which are mentioned in this list, they are commonly observed in people these days. And then what are the results of that? Shithili bhavanti mausani. So different diseases can be covered under this heading. So Shithili bhavanti mausani can be uh, muscular dystrophies also. Vimuchante sandeha, different diseases of joints. Vidayate raktam, vidaha in rakta. Maybe certain types of blood cancers. Vishandate cha analpam meda, na sandhyate astishu majja. So different diseases related to bone marrow, even some cancers. Shukram na pravartate, infertility. So different diseases. So under this also certain patients of cancer are having these kinds of hetu, and therefore they develop these kinds of conditions. Now, what is the role of Vat, Pitta, and Kapha in when such kind of Vikrut Vruddhi takes place in our body? Then what kind of role Vat, Pitta, and Kapha are playing? So, Vikrut Vat is responsible for Sanyog and Vibhag, and therefore here abnormal divisions of cells are taking place, and that is due to Vat. More details we are going to see further. And Vyuhan is the function given of Vat. Mainly Vyanvayu performs Vyuhan of the dhatus. So arrangement of the dhatus. So there is abnormal arrangement of the dhatus of the cells, and that's how such kinds of abnormal growths take place. When there is Pak, abnormal Parinaman,
आम्हाला तर जॉईनच करते सेट पॅन्ट बी रीच बाकीचे किती लोकांनी
No voice.
okay. Now I am audible.
Yes, sir. Audible.
Now audible, no? Okay.
Yes, sir.
In between there is some problem with internet. So it is described that Sharira avayavastu parmanu bhedena aparisankhya bhavanti and tesham sanyoga vibhage parmanunam karanam vayu karma swabhavascha. So parmanu can be correlated with cells, that means functional units rather. So tesham sanyoga vibhage vayu karanam, but not just vayu, karma swabhava. So in the commentary of that, it is told that na kevalo vayu kintu karma swabhava pari grihita eva. So karma, purva karma is associated with sayog and vibhag, which is performed by vayu. And abnormal sayog vibhag is observed in this abnormal vibhag, division of cells is observed in these patients. And in that, in many patients, karma is observed. So I had one patient who had breast cancer, and she was undergoing Ayurvedic treatment, and she got good improvement. That size of the growth was decreased considerably, old lady. But then she had a fall in her house, and exactly at the same site where that growth was there, she had injury. And then again, the growth was increased. Then again, for few months, we gave the treatment. Again, the growth decreased. And then again, she had a fall and corner of the table. And again, the injury was at the same site. Now you can understand why at the same site injury. What is the reason? Is it coincidence? And twice it is the coincidence. So there must be something like purva karma behind this. So that's why in many patients, this kind of factor also might be there. Although we are not performing Daiva Yopashraya Chikitsa, although it is part of Ayurveda, but we are not performing it much. But in such patients, this kind of treatment also should be considered. So Purva Karma is also associated with such abnormal division of cells performed by Vayu. Then Sarve सर्वैव ही वृद्धि प्रायो अतिसंतर्पण निमित्तत्वात् श्लेष्मणानुगता. Important sutra. So normal growth development is also related with prakrut. Normal growth and development is also linked with prakrut kapha, and abnormal growth also is linked therefore with vikrut kapha. So if vikrut kapha is there, then also abnormal growth and development can take place. So therefore vikrut kapha should be considered. Now all these theoretical concepts, when you will see the patients, there all these concepts are practically applied. So there you will understand the application of these concepts. In Guna of Vata, Ruksha, Laghu, Chala, Bahu, Shigra, etc. Guna are described in Charak Vimansthan 8th chapter. In that one, Bahu Guna is very important. So this Bahu Guna of Vata leads to multiplicity, leads to abundance, but the quality may not be maintained. So therefore, Vata Prakriti, they may be tall, they may be having long bones, and that's why first BMS students write them as Astisar, but they are actually not Astisar, but they are Vata Prakriti. And because of them that they are having elongated bones. So Bahuguna. So quantity wise more, but quality less. So this Bahuguna of Vata is very important. So therefore, when Vikrut Vata Prakop takes place, then due to this Bahuguna, multiple cells are produced. So many cells are produced, but they are not of good quality. They are not performing the normal functions. This is also very important. Then for Vikrut Vriddhi, it is described that Sharirasya Abhinirvrittir Abhivriddhi Rasaja Bhava. It is described. So Prakrut karma of rasa is very important for normal growth and development of the tissues. And therefore Vikrut rasa, that means rasa dushti, can be important factor in abnormal growths. So this also we have to keep in mind. So in different patients, some of these factors are observed. That we have to keep all these factors in mind, and when we are examining the patient, we have to find out what is wrong in this patient from all these factors, which factor is not functioning properly, and that's why this abnormal growth is there. Tesham Kshayavriddhi Shonita Nimitte. This is a sutra from Sushrut Sutrasthan, and in that it is described that Rakta is also important for Vriddhi, Prakrut Vriddhi, and for Vikrut Vriddhi also, therefore Rakta is very important. And as I told, Vikrut Karma of Jivan, and therefore even the cells which should have died, which should have destroyed, they are also surviving abnormally. This is due to Vikrut Jivan Karma of Rakta, and that's why Rakta also should be considered. So Rakta is very important factor in different types of cancers, and even now we will further see Avayav Utpatti. In all Utpatti of all the Avayav, Rakta is linked, and that explains about many kinds of metastasis, how that metastasis actually takes place. So Rakta is the common link between all these different organs, and that can form the link for that metastasis. As I said, Shukra or Sarvadahik Shukra especially is responsible for new generation of cells in the body, and that's why abnormal cells, when they are produced, then also Sarvadahik Shukra should be considered, and therefore Sarvadahik Shukra, we should keep on watch on that. Now in when we Vat, Pitta and Kapha we observed, and different role of different dhatus we are observing now. So Vat, Pitta and Kapha, we find that in all these patients of cancer, Tridosh are involved, and the treatment is not as simple as that. Okay, Vikrut Vriddhi is there, that's why Lekhan should be done. Because as soon as we start try to perform Lekhan, then Vat Prakop further takes place, and that's why the growth starts at a faster rate. And that's why Vat Prakop also should not take place, but Lekhan of Vikrut Vriddhi should take place. And in many patients, you know that bala of the patient is very important. So as long as bala of the patient is good, then he can tolerate the treatments, then he can survive. And if the bala of the patient is not good, then he cannot tolerate the treatments. And many patients of cancer, they die due to daurbalya or cachexia or such kinds of conditions. So rather than cancer, they die due to this. So that's why bala of the patients also should be maintained, and that's why Shukra and Oj, they should be properly maintained. So all the treatments for which we are giving for Lekhan, they should not be such that Shukra or Oj will be destroyed by that. So that also care we have to take. So all the dhatus for proper growth and development of dhatu, or maybe different tissues, we will say in today's terminology, different dhatus are having different role, as you all know. So in Vikrut Vruddhi, such as cancer, also we have to take them into consideration. Rasa performs Priyanan and Poshan. So as long as Rasa is Prakrut, Prakrut Poshan will be observed, and if Vikrut Vruddhi is taking place, then there might be Rasa Dushti, and that's why Vikrut Poshan is being provided to them. And Jivan Karya of Rakta already we discussed. Wherever there is Bruhatva, when there is a larger size of your tumors or the growths is size is large, then mouse and maid we have to consider, because Bruhatva is due to them, and Akar Vruddhi and Bhar Vruddhi due to them. When there is hardness in that part where cancer is there, then we will have to consider Asthi, because Sthiratva, Drudhatva is due to Asthi. So Vikruti of Asthi, Vikrut Karya of Asthi, and therefore abnormal hardness is observed at that site. Samvedana and Snigdhatva are related to Majja. Abnormal sensations or oversensitive, or sometimes the patients, they don't get any sensation till the sizable growth is there. Till then they don't get any sensation, then only they come to know. So their Majja Dushti we will have to consider. And Sarvadik Shukra, Nutan Utpatti, that we have already discussed. Now, स्वस्थानस्थस्य कायाग्नेर अंशः धातुषु संश्रितः तेषां सादाति दीप्तिभ्यां धातु वृद्धि क्षयोद्भवः. In the commentary of this, Das Pandit, a commentator from 10th century, he has said that Sad and Dipti are normal procedures. Just like when we get hungry, that times Agni Dipti takes place, Jatragni Dipti. And when the digestion is completed, comparative Sad of Jatragni is observed. So in the same way, rhythmatically, Dhatwagni are also having Sad and Dipti, and that is perfectly normal. But when there is Ati Sad and Ati Dipti, then abnormality takes place. So when there is Ati Sad, then Dhatu Vruddhi takes place. So, but it is Vikrut Vruddhi. So Ati Sad of Dhatwagni can lead to Vikrut Vruddhi. And this is very important factor. So Dhatwagni Mandya can lead to Vikrut Vruddhi. This is very important factor. There was one Vaidya Ram Singh Gohil, and he was practicing near Rajkot in Gujarat, in a village called as Bichia. We have one respected guru from Rajkot. He might be knowing about him. And he had an Ayurvedic hospital for the treatment of cancer in that village. And many patients from different countries were coming to take the treatment from him. And he wrote one book, Cancer or Ayurveda. In Hindi, he wrote one book. In that book, he wrote about his concepts about cancer and commonly which medicines he found as most useful in the treatment of cancer. That also he has mentioned. So according to him, just a passing reference I will give, that according to him, 11 medicines as per him are most important in the treatment of cancer. And according to him, most important out of them is Rohitak, as per his opinion. So Rohitak should be used in many patients. And we have got an experience that if Rohitak is used in different forms like Rohitak Asav or in other, various other forms, then usually we are able to prevent the metastasis. So that's why it is very useful. So
Vichya village. Village name
Vichya.
Vichya.
Vichya. Okay. Vichya. I pronounced it wrongly.
Near Rajkot. Yeah, Vichya.
Yes. Okay. So as per him, in his book, he has highlighted the role of Dhatvagni the most. As per him, Dhatvagni Mande is most important factor in such abnormal growths. And that's why this Dhatvagni Mandya and that should be considered. In Ayurvedic texts, proper growth and development of dhatus, it is told that Anupahata Sarva Dhatushma Maruta Srotaha. So Dhatvagni should be proper. That Vata means Vyana Vayu, which performs Vyona of the dhatus, it should be proper. And that Dhatuva Srotas, that should be proper. So these factors, if they are functioning normally, then proper growth and development of the dhatus takes place. And therefore, in Vikrut Vritti also, these factors we have to consider. So we have just discussed about Dhatvagni Mandya and role of Vyana Vayu. So if Vyan Vayu is not functioning properly, then also Vikrut Vyuhan takes place, and that's why such abnormal growths can be observed. And Dhatuva Sroto Shuddhi should be always there. Otherwise, also a lot of abnormalities are produced. So Vayuatmakam Dhatu Vyuhanam, and in the commentary of that Chakrapani has given that Dhatu Vyuhan means Dhatu Rachana and Dhatu Vahan. So transportation of nutrients to that Dhatu, and then specific arrangements in that Dhatu, they are due to Vayu, that means specifically Vyana Vayu. Now, like I told, Avayav Utpatti also we have to take into consideration when that cancer is related to a specific body part or specific organ, then we will have to take into consideration the Utpatti of that body part according to Ayurveda. So it is told that Samanena Admayamanasya Dehoshmana Pachamanasya Shonitat Jayate Yakrut Pliha. So from Rakta, Yakrut and Pliha are observed. So Ayurveda Sharir is so much important in practice. And based on Ayurvedic Sharir, we can treat very difficult conditions also based on Ayurvedic Sharir. So when such organs are affected, we have to take into consideration that from which dhatu these organs and how they are formed. And therefore, by going through the same route, we can correct the pathology in that organ. The abnormal growths also can be controlled. That means that dhatu utpatti we can control. So therefore, functional abnormalities we are able to control, but many times even structural abnormalities we are able to control. So in cancer patients, what I have observed that cancer patients will come to us with the hope that we will be able to avoid the operative procedures for them, like that. But as you all know, Shalya Tantra is also one branch of Ayurveda. So people think that with Ayurvedic treatment, all kinds of surgeries can be avoided, but it is not the fact. In Ayurveda also, in certain conditions, surgery is advised. So specifically, Mausajanam to Samshuddhi Shastra Ksharagni Karma bhi. So specifically when mouse is involved, then we should ask the patients to undergo surgery, and then to prevent the recurrence, we can give our treatment. But in many other conditions like cancers related to lymph or blood or bone marrow, where surgery is not advisable or surgery is not many times possible, there directly Ayurvedic treatment also we can give, and that experiences now I will share up to you after some time. So Rakta Penat Puppusam, Rakta Kittat Undukaha. All this is very important. So Rakta Kittat Unduk and Rakta Pen Puppus. So that's why some people they think in that way that Laksha is having its nature just like Rakta Pen, just like pain, froth like appearance. And that's why it is specifically acting on Puppus. So like that some people are thinking. Rakta Meda Prasadat Vrukkau. Even in patients related to chronic kidney disease also, this we have to remember that Rakta Meda Prasadat Vrukko. So if we want to maintain the function of Vrukka, then we will have to maintain Prasad Ansh of Rakta and Med. Prasad Ansh of Rakta and Med, as long as it is supplied to Vrukka, then the Vrukka will function properly. So that care we have to take. So in cancers related to kidney also the same thing we'll have to think. Rakta Maus Prasadat Antram, etc. Hruday, Shleshma Rakta Prasadat. Will not go in details of that. So considering this, now which Dhatuvagni is not functioning properly, and according to Utpatti of Avayav, which Dhatu is related to that Avayav or that site, which Dhatu is involved. So if whether the Dhatuvagni is functioning properly or not, if Dhatuvagni Mandya is there, so at the level of Dhatuvagni, Deepan and Pachan, if we will go through Bhav Prakash Nigantu, then we will get a lot of medicines. I have classified and I have prepared a list of medicines, each medicine on which the specific dhatus or which specific Dhatuvagni and Bhutagni they are acting. That a list I have prepared, and that becomes very useful in our treatment. And also I have prepared a list of medicines acting on specific parts of the body, like specific medicines acting on Kati, specific medicines acting on Hruday, specific medicines acting on Udar, like that are given in the Bhav Prakash Nigantu. So specific part of the body, specific medicines acting on Twacha. So this kind of study also is very much useful for us when we treat cancer related to a specific part of the body. So these are few examples given here that Guduchi acts on all Saptadhatu, but Gokshur specifically Apyagni and Parthivagni, on that it acts. Indrayo acts on Rasadhatvagni, Katuka acts on Rasadhatvagni, Kirat on Medodhatvagni, Kalmek also similar action, so Medodhatvagni. So this we can understand very well, but certain things are very peculiar. Ushir acts on Rakta Dhatvagni, Apyagni and Shukra Dhatvagni. So Ushir is mentioned in Shukra Shodhan Gana also, therefore. So it acts on Shukra Dhatvagni. So like that, if you will prepare the list, then it will be very useful for us while we are practicing. In the same way, Rasaushati, also we can understand that on which specific Dhatvagni, which medicines are acting. So this will be useful for students specifically. So that's why I have given, for example, a table here. Of course, the senior gurus, respected gurus, they are already knowing about this. So on Rasa, Yashad and Kharpar, they are specifically acting on Rasa, and therefore Lagumalini Vasanta specifically acts on Rasa. Rakta, Tamra, Kasis, Gandhak, they are specifically acting on Rakta Dhatvagni, and therefore medicines prepared from them. Hartal is also acting, therefore Rasamanikya is acting on that, and Tapyadi Loha, like Kalpa. Kalpa, I have not given a big list of that. There may be so many Kalpa acting on. Is specifically acting on, therefore medicines like Vasant and Kravyadaras I have specifically mentioned, because when the people who are eating mouse, and in the Hetu of Arbud, they have given that the people who are eating lot of mouse, they are likely to get arbud if they are not able to digest the mouse. That means I am not saying that all the non-vegetarians will get arbud, but those who are not able to digest it, they might get certain abnormalities. Like, and for that specifically, Kravyadras is given for the pachan of mouse in the body. That means mausajirna. For that it is specifically mentioned. Shilajatu is acting on Medha Dhatvagni, and Kalpa like Arogyavardhini, Mrutyunjayavati, Gandhak Rasayan, they are specifically, I have given few examples here, acting on Med Dhatvagni. Naga is specifically acting on Asti Dhatvagni, and Tapyadi Loha can be also acting on Asti Dhatvagni. Raupya and Abhrak are specifically acting on Majja Dhatvagni, and Vanga is specifically acting on Shukra, and therefore Kalpa like Chandraunshu, Chandraprabha. Chandraunshu is a unique combination of Vanga and Gandhak and other ingredients, but Vanga and Gandhak are peculiar ingredients of Chandraunshu, and that's why it is very important Kalpa. Chandraprabha, of course, everyone knows. So from the experience, it is found that in cancer patients, the Ayurvedic diagnosis can be of different types. Raj Yakshma may be the diagnosis in some of the patients. So sometimes how that Raj Yakshma occurs, that Samprapti will have to understand. Sometimes it is due to Rasadushti and Rasava Srotorod, and that way Raj Yakshma has taken place, or like that. So Pandu, that also due to Srotorod. Due to Srotorod, the nutrients are not able to reach to further dhatus like Rakta, etc. And that's why formation of Rakta is not taking place properly, and that's why Pandu is there. So Grahani is the diagnosis in many patients having cancers related to intestines and specifically colon and sigmoid colon. Their diagnosis is many times Grahani. Rakta Pitta is the diagnosis of the patients many times related to blood cancers. Kamala may be the diagnosis. Arbud, Gulma, Shwas, etc. diagnosis may be there. So according to the patient, these diagnoses we have to make. Like I told that not always that exactly the textual diagnosis we will be able to make, but the Samprapti we will have to understand from Ayurvedic perspective, then only we will be able to treat the patient. So as said in Charak Samhita, the name is not important, but understanding the dosh, dushya, etc. and Samprapti, that is very important. Vikaranama, Kushalana, Jirriyat, Kadachana, that can be practically implicable in these patients. Now, I will talk about some of my experiences of treating some patients of cancer. Some experiences I will mention in brief, and then 2 cases we will discuss in somewhat details. So up till now, at least in 3 patients of diffuse large B-cell lymphoma, all the lymph nodes were completely resolved. And the patients now, one of the patients, last 10 years, she is surviving very well. without any modern treatment. All these patients were totally on Ayurvedic treatment. One of the patient, boy from 14-year boy from Odisha, he's also completely, his all lymph nodes are resolved, and last 1 year recurrence has not taken place. And this lady, 10 years recurrence has not taken place. And there are more patients who are currently under treatment of diffuse large B cell lymphoma. So we can do something. See, I'm sharing frankly my experiences with you. I'm not claiming that all kinds of cancers can be cured by Ayurveda. If that was so, then we would have already got Ayurvedic people would have already got some Nobel prizes for that purpose. So, but we have to, from our understanding of Ayurveda, we have to deal with such patients. And if we deal with such patients, in many patients we get good success. In many patients we are able to cure it. In many patients we are able to control it, and we are able to improve the quality of life of these patients. In many patients we are able to avoid the recurrence. So whatever we can do, that will be still helpful for the patients. So whatever knowledge we have, accordingly we have to help the patients. And if we think that our present knowledge is not uh, sufficient enough to treat this patient, then there is no shame. That means, very frankly, we can take help of other experts in the field. In other experts from Ayurveda also, other experts from other pathies also, we can take help. There is no harm in that. That means ultimately the patient should get relief. That is our aim. But in many patients with Ayurvedic treatment, that means it is well known to everyone that the side effects of the chemotherapy, radiotherapy, like treatments given by modern medicine, they can be managed by Ayurvedic treatment, and we can give relief to the patients. And quality of life can be improved in these patients. That also is known to everyone. But even the treatment also can be very helpful in many patients. And in many patients, alone Ayurvedic treatment also can be helpful. So that decision we take on the condition of the patient. For example, I had one patient who had dysgerminoma of ovary long back, and in that patient, that was the first patient of dysgerminoma of ovary who came to me. So I was not knowing much about that. I had not experienced more about that. But according to the modern treatment, they are getting some 94% success in the treatment of these patients. So I advised her that it is better that you undergo the modern treatment, and to avoid the recurrence, we will give the treatment. So actually, she was insisting that whatever happens, you give us the treatment. But we should not be adamant in such conditions. If that treatment is so much useful, then let the patient take that treatment, and to avoid the recurrence we will give. But in certain patients where the modern treatment is not possible, or in certain patients where we have got the experience, there we give only Ayurvedic treatment also for these patients. So like that, now one patient, a 72 years old lady, she had history of breast cancer already. Then last year she had some recurrence, and then after around 10 years she had some recurrence, and then she also developed squamous cell carcinoma at the skin, and then she was being treated for that. Then she developed small lymphocytic lymphoma, and then she was undergoing for that, and then she developed chronic lymphocytic leukemia. So then the doctor said that now at a time you are having 3 to 4 cancers in your body, and it is not possible for us to treat all of them. And according to them, the expected lifespan was only 3 months. They said that we can't do much about this. Symptomatic treatment we will continue. But now last 1 year, that lady is only on Ayurvedic treatment, modern treatments, because they are not offering her modern treatment. So only on Ayurvedic treatment she is there, and she's still well. I'm not saying that she has completely recovered, but she's well. She's doing her, she's cooking, she's cooking the food. She's doing all her home works at home also, and that way she's well. And there was no recurrence of squamous cell carcinoma and small lymphocytic lymphoma. And for the other lymphocytic leukemia, that we are giving the treatment for that, and in that her hemoglobin was 5, and but still only last 1 year only twice she required blood transfusion, but otherwise we have maintained her condition. Like that, in recently we had 2-3 patients of MDS, and in that also the hemoglobin of one of the patients was 7.2 something, and he required blood transfusion at about every 3 weeks. He required blood transfusion. But now 1 year has passed, and in this 1 year, only twice he had to undergo blood transfusion. That too, what happened? He had gone for investigations at the hospital, and there they said that no, first we will give blood transfusion and then only we will treat you. So that time he had blood transfusion, but otherwise he is not having blood transfusion, and his hemoglobin is presently 10, and he's maintaining it, and symptomatically he's better. So in many cancer patients, we can help the patients. Now, certain patients, there are so many patients. I'm not going in details of all of the patients. One patient who was having a high grade uh, means cancer related to bladder and urinary tract. But she was told that within a month or 2 months it will recur, because it is having a tendency to recur again, and then you come back after the chemotherapy. She was asked to come back uh, immediately, but now more than 2 years have passed, but there is no recurrence at all, and they did cystoscopy also to confirm that, and 3 times already scan was performed, but cystoscopy also they performed, and that doctor who is performing that cystoscopy said that I'm having 25 years of experience, but this is the first patient of this kind that in which recurrence has not occurred. So like that, in many patients we can help the patients. Now, 2 cases we will discuss. One person. This is also one thing about, in brief, I will tell about one patient, a 67-year-old patient. He came in 2012 and he was diagnosed as bronchogenic carcinoma. After diagnosis, he did not go for any modern treatment. He was only on Ayurvedic treatment. And what I'm trying to highlight about him, that his growth reduced and he had good quality life for many years. That is all right. But one thing I will like to highlight, that this was his report, although you will not be able to read it. So I have highlighted important part. Now, apart from that growth, what is written here, there's the moderate left pleural effusion with subsegmental collapse of underlying posterior and lateral basal segments of left lower lobe. So there was collapse of certain segments of uh, left lower lobe, and that's why that they said that it will not recur, or even I thought that this will not improve, but at least the remaining part of the lungs we should protect. But then when we started our treatment, then afterwards, you see that what happened, that the left pleural effusion with underlying lung collapse has resolved completely, and there are no metastatic lung or liver lesions. Like that result was. So this was even surprising for me also, that even the collapsed part of lung also was completely started functioning again. So that's that one. So in this patient, no metastasis outside the right lung. A collapsed lung was completely resolved. There was regression in tumor size, and he survived for 6 years without any modern treatment. He was coming by bus, climbing the stairs and coming to me, and he was very well, having good quality of life. He continued his routine life as shopkeeper without any major illness. Even Shwas also he was not having much. But then he became irregular and he stopped the medicines. And then after stopping the medicines, after 4 months, his condition worsened and then he expired. But till then he was very well. Now to helpful for us to correlate with the texts when we write like this. So, Baddha Mala Pravritti Asamadhankarak, Mutra Pravritti Avishesh. So, unless we have confirmed that it is normal, then we write Avishesh. That's why Avishesh is written. So, he was already having diagnosed as esophageal cancer before 1 year, and then 6 months back, he was diagnosed as having cancer in liver. And after chemotherapy, his CA liver lesion will reduce, but within 1 to 2 months, it will again growth will take place. So again he has to take chemotherapy. So again he went back and took chemotherapy. Again that size reduced. within 1 or 2 months, again the growth was so much that again he had to go to for the chemotherapy. So it was recurring at a very faster rate, and it was not responding to the chemotherapy. So after thrice it happened, then he opted for Ayurvedic treatment, and then onwards he was only on Ayurvedic treatment. So these are all his reports, but important part I will highlight for you that in liver these lesions are there. So see, in segment 2, the lesions, the size is given here. Similar small lesion is adjacent to it, measuring 1.2 into 1 centimeter. So this is the size of the lesions in the liver, and with chemotherapy the size will reduce, but again it will recur. So in parikshan, so Ayurvedic parikshan is also very important. From that we get some concrete understanding about the condition of the patient. So he had nadi of samana and vyan vayu. So we have to focus more on these. Therefore, jivva alpa bhasma varna upalep. When there is bhasma varna upalep, we understand that since long he is having recurrent ajirna and sama doshas are accumulated in his body for since long time, then bhasma varna upalep is observed. Then udar lamban, and where specifically admadhvani is observed. Accordingly, also we can understand a lot of things. So here Vam Vangshan Admadhvani was observed. Therefore, we can understand that Mala Pravartan was not proper, and that's why in Vam Vangshan then we get Admadhvani. Nasagra Prututva. From nose, from the examination of the nose also, we understand a lot of things. That means specifically about Agni and Dhatvagnis, we understand from the examination of the nose. So Nasagra Prututva, that means it was indicative of here Rasa and Mouse Dhatvagni Mande, specifically. Anga Karshne and Prabhani. In many such patients, Prakrut Dhatu they are having Kshay, although Vikrut Vriddhi is there, and that's why Karshne is observed and Prabhani is also observed in many such patients. So treatment offered for him initially was like this, that Hirak Rasayan, that means Hirak processed 250 times is used for this purpose, and 12.5 milligram dose is given in that capsule. And then Triphala Pravala Panchamrut Rakta Pachak Dhamasa Bhrungaraj and Sajjikshar was given initially. So Dhamasa performs Anuloman. I'm not going in details of each action of each and every medicine. If time permits, you can the students can ask later on about that. Bhrungaraj is specifically for Amlika Rutkantha. It is very important because it is considered as Ksharadharmi. So it controls Amlatva very well. And Bhrungaraj is also Vaidyas, they observe that the plants, the nature they have in the behavior they have in nature, similar work they can perform in the body. So Bhrungaraj, what is observed, it is found many times near dirty water also. In the corner of a gutter also, it can be observed sometimes. That means it is having a capacity from that dirty water also, good quality, Poshakansh he is able to extract, that Bhrungaraj is able to extract. So therefore, for Pruthakkaran of Sarakitta and for proper Shoshan, this Bhrungaraj is useful. So that's why it is used. So like that, for every medicine, the reasoning can be told. Tapyadi Loha, because Parinaman of Rakta, and therefore on specifically on Yakrut, which is linked to Rakta, on that Tapyadi being containing Shilajatu, and Raupya also. Raupya also performs Lekhan, but Raupya is giving Bala to Saptadhatu. So here we require such medicines which will perform Lekhan also, but which will maintain the Bala of the Dhatus also, and which will not give rise to Vat Prakop. So that's why such medicines are selected. So Tapyadi Loha contains Shilajatu, so it also performs Lekhan due to Raupya also, but it also maintains Bala, and Parinaman of Rakta is improved. So Parinaman of Rakta has to be improved if we want improvement in Yakrut. Navya Sutshekar is a specific part prepared by Vaidya Gayakwad from Solapur, and in that Sutshekar all the ingredients are kept intact, but some additional ingredients like Jhar Mora, Dhamasa, Kukkut Nakhi, etc. are added in that. So Kukkut Nakhi is specifically added here because it is observed that Kukkut Nakhi controls Gati of Vyanavayu. All these medicines here are given in Vyanavayu, Samana and Vyanavayu. So Samana Vayu, then it will act on Pachak Pitta, then it will act on Yakrut properly, and Vyan it performs V1 of the dhatus. So that's why in Vyan Kal the medicines are Vyan and Udan we take because we want divided doses. So Vyan and Udan Kal. So Guduchi, Kukkutnaki, because it controls the gati of Vyan Vayu, and Kukkutnaki also performs Lekhan of Vikrut Vriddhi, but it also is Balya. Now the cancer is understood in by certain Vaidyas in such way that the memory of the cells is corrupted, and therefore the cells contain a memory, and they know how to grow, how much to grow, when that cell should be destroyed. But due to that corrupt memory, that cells keep on growing and abnormal growth takes place. Like that also certain Vaidyas think, and therefore medicines acting on smruti also Vaidyas are using in the treatment of cancer, because smruti of that cell should be improved, like that certain Vaidyas say. So that way also this Kukkutnaki is useful. And Rohitak already I told, it is specifically acting on Rakta. It is mentioned in the text in Yakrutarbud, in Yakrutodar Plihodar. So it is acting on Yakrut, and it is useful, and Daru Haridra they were given. And initially he had symptoms related to Krumi, like Adman. Just after having food he will have Adman. So that's why Krumi Kuthar and Kampillak was given for a few days. I will highlight the important part of these reports. So after we started our treatment, after around 4 to 5 months, this report was taken. And in this, what you find is that left hepatic, some part was already resected by them and chemotherapy was given. No new lesion. This is very important. So after we started our treatment, after 4 or 5 months also, no new lesions were there. We continued our treatment. Again, after another 4 to 5 months, when the CT scan report was taken, that report I have not shown because you will not be able to read, but the impression I have highlighted that no recurrent metastatic disease. So recurrence was not there, and even metastasis was not there observed after we started our treatment. So in this patient, similar treatment was continued for longer period. So symptomatic relief he obtained within almost 2 months, 2 weeks. And thereafter, we at regular intervals, his CT scan reports were taken, and by that it was confirmed that he was having no recurrence. Even after 2 years, he was not having recurrence. But the patients sometimes they don't understand the importance of that. When there was no recurrence within 2 years, he was very happy, and therefore he stopped the treatment. Symptomatically also he was well. Later on also he was running a shop, and we used to observe him that he was there for 3 years. He survived. Then what happened next we don't know. Maybe recurrence took place or what happened or any other problem, but after 3 years we got the news that he expired. So after our treatment the recurrence was completely stopped, and even after that also recurrence was not there. We don't know exact details that what happened before his death, but this was the result. So certain patients I told that they were treated completely with Ayurvedic treatment and then they recovered. Certain patients that lung cancer, I told that completely with Ayurvedic treatment he survived for a long time and the growth was reduced. Here recurrence of growth was taking place, but with our treatment that recurrence was completely stopped and he did not get further growth. Now one other example I'm presenting to you. Here that lady, she had CA, ovary and endometrium. So in 2017 December, so I am presenting to you the cases which we have observed over the years. Immediately when the growth reduced, we are not presenting the case because that may recur again. So we observed the cases for 5, 6, 7, 8, 10 years, and then only we are presenting these cases to you. So this case was in 2017 December. She came to our clinic, and her history from Ayurvedic point of view, Adhodar Shul was there, Udar Gaurav and Kshuddha Mandya, and continuously Barakshay, she was reducing weight. And then she was detected with CA, left ovary, and also endometrium. And she was already operated on 21st November 2017. And then she came for Ayurvedic treatment. Now, this lady, she was, that means she left her house for a very noble cause. She is working in a charitable trust and on very, very small, less salary. That means salary word also is not useful here. That means honorarium she is getting, and that's why. And now they have now already that time she was 64 years old. So they were after in the old age they had not much money with them, and the work they were very honestly and dedicatedly they were doing social work, she and her husband, but they had not much money with them for the further treatment. So that's why that trust approached us that can you give some treatment. So we said that there is some risk involved in this, but they said that no, you continue with the treatment and then we will see how it happens, and if the recurrence takes place then we will go for the other treatment. So they insisted, so we started like that. But like that in many patients without chemotherapy or radiotherapy also, we treated the patients in certain conditions and the growth did not recur. So here also we started our treatment. So what was observed in him, in her condition? Baddhamala pravritti, Adman Udargaurav, Adhodar Shul, Kanthopale Pratiti. She used due to Udavartan, she was having history of CAS repeatedly. Anga Aushne Pratiti. Now you can understand Rasadushti in this. Shirashul. After operation specifically, she was getting it. So here what we observed that Rasadushti, by observing her, and Purva Vyadhi, since 2.5 years, she was repeatedly having Ubhay Prapad Kandu and also Panital, means palms and soles. There she was having severe itching. Swagrauksha Dalan, that means scaling and cracks there. And after Kandu, some Srav will take place, Lasika Srav. So now one interesting thing I have mentioned here, that initially she was being treated by another Vaidya for this Kandu, etc. And he applied Jalavka on her prapad, that means on her foot. But with that, not only there was relief in Kandu, etc. in the foot, but her Kandu in hands also was reduced due to that. Now again, Ayurved Sharir is very important. Both these parts of the body are related to Rakta, because in Rakta Sar, both these are mentioned. So that's why, otherwise, what is the explanation that when Jaloka was applied on the foot, how the hands got relief? So Ayurved Sharir is behind that. So she was having Yonika Jalavat Srav before 1 year, and it was so much that she had to use a pad for that, and Yoni Kandu. So from overall her history, what we observed that there was initially Rasadushti, then there was mouse and Medo Dushti. So then Sarvadaik Shukra Dushti also. So mouse and Med. So Garbhasha is mouse ghatit avayav. So therefore mouse Dushti affected that. And also because Shukra Dushti was there, that's why Garbhasha and that ovary, and therefore Vikrut Buddhi took place at that site. So we had to concentrate on Rasa, Mouse Med and Shukra mainly in this case. So Nadi Saman and Apan here, Atyalpa Shvetaba Upalep. So what kind of color of that Upalep is there on that also? So Jivva Parikshan, last year I had given a lecture on Jivva Parikshan at Bhopal with photographs of tongues of various patients. From tongue examination also we can understand lot of things. So Udar Lamban Dakshin Kukshi Alpa Admadhvani. This indicates that Sarkitta Vibhajan and Shoshan part is not taking place properly. Netra Alpa Panduta, Akshikut Karshni. Ganda Shoth, that also indicates recurrent Ajirna and Mouse Dushti. Nakarauksha and Pandutva, because of Prasadushti, she had developed Pandutva also. Nasagra Prututva, again here it was indicative of Mouse Dushti. Prakoshtha Karshni. Now, each and every part of the body is also linked with specific dhatus. So Prakoshtha is linked with mouse as well as it is linked with Shukra. So there Karshna, specifically Karshna over there indicates involvement of these dhatus. So Pandutva and Prabhani. And for Samhanan, we examine Pindika and other mouse stan. So there was Mardav in that. That means mouse dhatu was Durbal and Alpa Shaitilya was there. So mouse dhatu was Durbal. So these were her reports when she underwent the operative procedure. So I will highlight the important part of that. So endometrium high-grade malignancy was there, and myometrium, presence of tumor is seen. So like that, in right ovary and fallopian seen tumor, okay, not seen. Left ovary high-grade malignancy with necrosis, and omentum also scattered atypical cells were seen. So this was the condition, and then she got operated. Now after this is again before the operative, that the tumor was seen in uterus and ovary, as ovary is favored over metastatic disease, uterus and ovary, both. That means she was diagnosed as adenocarcinoma of ovary and endometrioid adenocarcinoma of ovary. That means endometrium and ovary both were involved. So what treatment we offered to him? That Hirak Rasayan again and Suvarna Malini Vasanta for performing Rasadhatvagni Dipan, and because it contains marriage, it also acts on mouse Dhatvagni. So both Rasa and mouse Dhatvagni Dipan will take place with Suvarna Malini Vasanta, and Suvarna will maintain Dhatu Bal also. And Suvarna is not increasing Kapha, so Vikrut Vritti will not also take place while we are maintaining the Bala. Suvarna gives Bala to all 7 Dhatus. So that's why this was given, and that was given in Prata. Actually, her Kapha Prataha Kal is there only mentioned, but we want to give in divided doses. So that's why Prata Sayam, like that we are giving. So Sayam Kal is also empty stomach mainly. Then after in Pratham Praharop Sayankal also Kapha Pradhanya is there. So it is one Kal which we can use for Kapha. So in divided doses, Prata Sayam we give. And then Chandraprabha, because that Garbhashay was initially involved. So Triphala, Raktapachak, Bhrungaraj, Dhamasa, Chandraunshuras was here used, and Sukshma Triphala. And Kalmek syrup was given here. This Kalmek syrup is prepared on the part based on famous Vaidya R.R. Bhatt from Udupi. And this is very much useful in climatic conditions in Goa and the coastal regions. So that's why we are using it for Rasa, Medo Dushti, Mouse Dushti. We are using it, and it is also performing Am Pachan. It is also avoiding, it is also Prakriti Vighat for Krimi. For recurrence of Jwar also, this Kalmek syrup is helpful. So we are using it. So this treatment was offered to her. And also in Vyanudan Kal, Navya Sudshekar, Kanchanar Gugul, Wakeri Loa. Wakeri is also one medicine which is useful in the treatment of cancer. That it is performing Lekhan of Vikrut Vriddhi. And Wakeri Loha, so it will maintain Bala also. Kasis is very important medicine. It also performs Lekhan, but it is also Balya. And it also performs Ampachan. So that's why it is very peculiar, and it is acting on from Rakta to mouse Parinaman will be improved due to that. And that's why Kasis was given like that. And Rohita Karishta was given for her. And Krumikuthar was initially given. So she continued the treatment. Symptomatically, she improved. And in the next follow, a lot of improvement was there already symptomatically. So symptomatic improvement was already there in the further follow-ups. All Adman, etc. She got relief in that. We continued our treatment. But now we changed afterwards, after the Dhatvagni Dipan, Chaturmukh, we thought that it will be more Balya because she was having Jatragni Manya also. So from Grahani Rajakshma takes place, then Chaturmukh Ras is very much useful. This Chaturmukh Ras is different from Chaturmukh Chintamani Ras. Chaturmukh Ras part is given in Bharat Vaishya Ratnagar, you can refer to that. So this Chaturmukh Ras is used, and Rasa Dushti on that Rasa Dhatvagni, it specifically acts. And when from Jatragni Manya Am Nirbiti takes place and then Rasa Dushti takes place, there specifically it is useful. So that's why it was used in long term. And then other treatment was similar. So this kind of treatment was continued for her. And then later on in March 2018, once we took the PET scan, and in that I will highlight the impression. In that you will find that there was no further growth. That means no recurrence was there. Some lymph nodes were there, but they were likely reactive in nature. They were not metastatic as such. So this was observed in the next CT scan. Then we continued our treatment. Now since she was very poor lady, she was reluctant to take CT scan repeatedly because she was not having money. So later on, we continued treatment. She was not ready to undergo CT scan, but at least we said that after next year, we told that at least you undergo sonography. So in that sonography, normal, that means grade 1 fatty liver was there, but no recurrence of these growths was there. Now you know that 7 years have passed and she has still not got any recurrence of the growth. So this was the report of the sonography. Now in Goa, PET scan was not available. Only I think last month it is now made available in Goa. So that's why if you want to take PET scan for a patient, then the patient has to travel all the way to Belgaum or Kolhapur or other regions, and then you will have to. So some patients may not be in a condition to travel such distance. So that's why, but still she went and took PET scan initially in March. So radiography also normal report. So what was the outcome? Instead of chemotherapy or radiotherapy, the patient was on fully Ayurvedic treatment. See, remember that it was high grade cancer. It was already mentioned in the report. But she almost got complete symptomatic relief. No recurrence during last 7 years. And last 7 years, she is having good quality of life. That means she is having her routine, normal life she is having. And she is very well. Even a few days back also, once she visited our clinic for some other complaints like CAS, etc. So here I shared my views on how we can understand cancer from Ayurvedic perspective, and also clinically that understanding how that can be applied on the patients and what was the outcome when we applied on the patients. Few examples I have presented in front of you. So I thank Rashtriya Ayurved Vidyapit, the specially director madam, to give me an opportunity to present in front of you my experiences. And I thank all of you for your patient listening, and I hope that it will be useful for the students and it will encourage the students. So thank you very much.
Thank you, sir. Now we have our question answer session. If anyone have any doubt, they can ask.
दीक्षित साहब, बहुत सुंदर आपने फॉर्मूले का साथ जो बता दिया है, मेरे ख्याल से स्टूडेंट लोगों को बहुत फायदा होगा। इसके लिए आपको बहुत साधुवाद और बहुत धन्यवाद।
धन्यवाद सर, प्रणाम।
चलिए दीक्षित जी, बहुत बहुत धन्यवाद। बहुत अच्छा आपने जो है व्यापक रूप से गर्भाशय पर के कैंसर पर प्रकाश डाला। मैं ये पूछ रहा हूँ कि तो हीरक भस्म और ताम्र भस्म का इसमें क्या भूमिका रहती है? ताम्र भस्म की इसकी या ताम्र सिंदूर का प्रयोग कर सकते हैं?
जी जी, ताम्र सिंदूर का प्रयोग कर सकते हैं, किया है हमने कुछ पेशेंट्स में। और एक जो मेरे मित्र है, उनका कैंसर क्लिनिक भी है, तो उनकी फार्मेसी है, तो उन्होंने ताम्र, सोमनाथी ताम्र और हीरक, इनका संयोग बनाकर एक रसायन तैयार किया है, तो उसको भी कभी कभी उपयोग करते हैं। वो उसको अग्नि रसायन नाम दिया है उन्होंने।
एक हेमगर्भ पोटली रस है, आपने कभी यूज किया डॉक्टर साहब? पोटली रस का प्रयोग किया कभी? हीरक भस्म उसमें ताम्र भी दोनों है।
हाँ, लेकिन इन पेशेंट्स में नहीं किया जा। मैंने वो आईसीयू के जो बाकी पेशेंट्स थे जो कोमा में वगैरह थे, उनमें तो काफी किया, लेकिन इन पेशेंट्स में ज्यादा नहीं किया अब तक।
अच्छा, क्योंकि हमने देखा कि कभी कभी जब कार्सिनोमा का सर्जरी हो जाती है और वो कौन से कराते हैं, उसको आप जो रेस देते हैं, उसके 3 महीने बाद 4 महीने बाद कार्सिनोमा के लक्षण फिर दोबारा आ जाते हैं। तो अगर रेगुलर अपनी दवा चलती रहे आयुर्वेद से, काफी सफलता मिल जाती है, उससे दोबारा चांस नहीं रहते। चलिए बहुत अच्छा रहा, आपने उसके बनाए। थोड़ी हम लोगों को अल्प ज्ञान है, इसलिए हम आपसे पूछने की थोड़ा चेष्टा की है।
नहीं सर, अल्प ज्ञान क्या, आपके पास तो बहुत बड़ा अनुभव है। धन्यवाद।
धन्यवाद।
और किसी को भी कोई क्वेश्चन पूछना है या कुछ डिस्कशन करना है तो वो कर सकते हैं, माइक ओपन करके।
Hello. Excuse me. Sir, what is the role of Uric Rasayan in development of this cancer? They have very elaborately literary compilation has been projected in your lecture. But this is one point I wanted to know practically. Uric Rasayan, how this helps in disintegration of the cancer process. Then I will ask another question.
Okay.
See, initially, the causative factors, Ksharatattva Ahara is also one of the reasons for this dushti and leading to cancer. But the Ksharata, in the body, it is this acid and base. Base is required, which prevents the cancer or this cancer transformation process. But these two things I need to be cleared. Thank you.
Okay. So Hirak Bhasma, Hirak performs lekhan of Vikrut Vriddhi, but at the same time it maintains bala of the dhatus, and Oj is instantaneously improved by Oj, Hirak. And it is described as in Rasatarangini and in other texts, it is described as Ayushya. That means it is observed that when Hirak is started, usually, if not any other benefit, at least the lifespan of the patient can be increased. So in certain cancer patients who are in terminal stages, where we are not able to do much, at least the lifespan of the patient increases when we start giving Hirak. So Hirak is having so many advantages. So that's why Hirak is given in almost all the patients of cancer. But in certain patients, we give Vaikranta or other medicines also, not always Hirak. But in many patients of cancer, we give Hirak. And another thing is Kshar. So Kshar when in the body, so just like we discussed about how the role of injury or Pidan, Ghattan, etc. Like that Kshar also, if excessively it is taken, that it will also cause kind of irritation. And due to that irritation, the dhatus will be, ksharan will take place, damage will take place to the dhatu. And due to that, such Vikrut Vriddhi are likely to take place. So that's why Kshar in that way can cause. And that way, Kshar, Amla, that concept also we have to take into consideration while treating the patients. And this Vaidya Datar, who was performing Panchabautik Chikitsa, he used to think about Kshar and Amla much. And that was, I think, based on the concept of Sadrava and Nirdrava Pitta, which is given by Chakrapani, that Kshar and Amla, his concept. And accordingly, he classified the medicines also having Kshar Dharma and Amla Dharma. So like I told about Bhrungaraj. So considering that way also is very helpful in not only cancer patients, in other patients also, medicines which are having Amla Dharma and Kshar Dharma. Like that when we consider, then also it becomes helpful for us.
One more, they just, I want to know about Narayana Murthy, one Narayana Murthy in Karnataka, in a remote village that just now I'm unable to say, but he is very, very popular in treating even advanced type of cancers. He was the single formula to all the patients. That how nobody has taken, but I think recently he's expired some 1 year back. It is being continued.
I heard.
I think you must know about him.
So
things must be traced and to be researched. That is,
yes,
I wanted to say that
definitely
about this because now some yes, still his family members are practicing this thing, but it is now it is not so popular when he was alive compared to when he was alive. Okay,
so,
thank you very much.
Yes, sir, thank you. Like that, I mentioned about that Vaidya Ramsiha Gohil also. So there are so many Vaidyas who are having their experiences. So their experiences should be collected. And but some people, they have just experienced that I use this combination and it works. But as Vaidyas, we should try to understand how it works, the mode of action. So if we understand the mode of action, कैसे काम करता है, उसका काम कैसे होता है, और हम दोष धातु बलों की परिभाषा में
कम से कम थोड़ा थोड़ा
हाँ, तो इसलिए अभी मैं हिंदी बोल रहा हूँ। तो कैसे काम करता है वो औषध, मतलब लोगों का अनुभव होता है कि ये औषध मैं देता हूँ और वो ठीक होता है, लेकिन ये बताना चाहिए कि हमें ये ढूंढना चाहिए कि वो कैसे काम करता है, उसका दोष धातु मूलों पर एग्जैक्टली क्या परिणाम होता है और इसलिए कैसे काम करता है, ये अगर हम जान पाएंगे तो वो फिर साइंटिफिक हो जाएगा। नहीं तो फिर वो सिर्फ अनुभविक हो जाएगा। तो अनुभव का भी महत्व जरूर है, लेकिन उसको हम लोगों को इस तरह से परिभाषित करना चाहिए साइंटिफिकली, वो कैसे काम करता है, फिर वो और ज्यादा, मतलब सब लोग उसका उपयोग कर सकेंगे फिर अगर ऐसा हम लोग करते तो।
चलिए, बहुत बहुत अच्छा रहा। उस बार आपको उद्बोधन रह गया था बीच में, गया था, काम आई है, तो को दुर्भाग्य रहा कि आपके पूर्ण का अवसर नहीं मिला उसके काम को।
Sir, another question we have in our chat box, Dr. Tanuja. Good evening, sir. It was a very informative lecture. I wanted to know that how long we can use this Bhasma medication, and we use this for long period, then it will create toxicity or not?
तो अभी मैं जैसा सर ने कहा हिंदी में बताता हूँ, कुछ बात हिंदी में करता हूँ मैं। तो ये जो भस्म है इनका सबका अलग अलग एक्शन है। तो जो रसशास्त्रीय औषध है ना, तो उनके बारे में वो वीर्यवान होते हैं बहुत, और वीर्य के बारे में ये कहा गया है कि वीर्यम यावत अधिवासात निपातात च उपलब्धते। तो यावत अधिवासात, इससे ये सूचित किया गया है कि वो हमेशा शरीर में नहीं रहना चाहिए, वो जब तक शरीर में रहता है तब तक अपने वीर्य से काम करता है। तो जो वीर्यवान औषध है उनमें ये अपेक्षा है कि वो शरीर में प्रवेश करने के बाद अपने वीर्य से अपना काम दिखाए और वो बाहर चला जाए। लेकिन उसमें भी अपवाद है, जैसे लोह है, जो ऐसे है वो शरीर का हिस्सा बनकर रह सकते हैं धातुओं का। अब वो इस पर एक डॉक्टर स्कंदन करके जामनगर में मेडिकल कॉलेज में प्रोफेसर थे, तो उन्होंने एक ये स्टडी किया था कि शरीर के हर धातुओं में, अलग अलग धातुओं में कौन से मेटल्स और नॉन मेटल्स मिलते हैं। तो उन्होंने ये तो स्टडी किया, लेकिन उसका क्या सिग्निफिकेंस है इसके ऊपर नहीं स्टडी हुआ था। तो ये है। और अभी मैं जिनकी बात कर रहा हूँ, ये जो मैं जिन भस्मों का उपयोग कर रहा हूँ, वो जहां से मैं खरीद रहा हूँ उनका ही एक रिसर्च इंस्टीट्यूट है, और उस रिसर्च इंस्टीट्यूट का कोलैबोरेशन नेशनल कैंसर इंस्टीट्यूट जो यूएसए का है उनसे अभी है टाई अप उनका रिसर्च चल रहा है। और वहां पे ये जो भस्म है, ये देने के बाद ये भस्म शरीर में एग्जैक्टली कहाँ पहुंचता है और हर टाइप के सेल पर, मतलब नॉर्मल सेल पर उसका क्या एक्शन है, कैंसरस सेल पर क्या एक्शन है, डिजनरेटेड सेल पर क्या एक्शन है, ऐसा वहां पे स्टडी किया गया है। इसलिए वो उसकी सेफ्टी के बारे में हम लोगों को चिंता नहीं है। अब ये जो मैंने कहा जो बलवान औषध है, इसलिए उनको जब तक जरूरत है तब तक देना चाहिए, थोड़े बहुत लंबे समय तक नहीं देना चाहिए। लेकिन जो हीरक है या लोह है या इस तरह के, ये उनको लंबे समय तक दिया जा सकता है, क्योंकि वो सुवर्ण है, रौप्य है, जो धातुओं का बल बढ़ा रहे हैं उनको लंबे समय तक दे सकते हैं। लेकिन ताम्र है, जैसे कि जो लेखन कर रहा है, तो उसको ताम्र को हम लगातार देते रहे ऐसा नहीं कर सकते। मतलब उसको कुछ समय बाद, कुछ महीनों के बाद उसका डोज कम करना चाहिए धीरे धीरे। हमें माइल्ड मेडिसिन पर आ सकते हैं हम लोग, उसके बदले हर्बल मेडिसिन पर आ सकते हैं हम लोग। लेकिन जो ऐसे है सुवर्ण रौप्य जो धातुओं को बल देते हैं, उनको लंबे समय तक दे सकते हैं हम लोग।
सर, हेलो सर।
हाँ
सर नमस्कार, मैं वैद्य दीपक गांधी, दौंड, पुणे से। सर कई बार डिटेल में केस लेने के बावजूद भी कोई हेतु नहीं मिलता, खासकर छोटे बच्चों में, तो जहाँ पे हम सोचते हैं कि ये कर्मज व्याधि है। तो ऐसे इसमें सर चिकित्सा के दृष्टि से क्या ये सोचे द्रव्य?
नहीं, ऐसे अब हम लोग तो युक्ति व्यपाश्रय चिकित्सा ही करते हैं ज्यादा। लेकिन अगर हम लोग पता करते हैं, मतलब वो पता करने के भी उपाय है। जैसे वाग्भट ने बताया ना कि दृष्टापचारजः कश्चित कश्चित पूर्वापराधजः तत्संकरात् भवत्यन्य। तो जो पूर्वापराधजन्य है उसमें हेतु मिलते ही नहीं, या फिर जिनके में कॉम्बिनेशन है कि पूर्व कर्म और अभी के हेतु, इनका कॉम्बिनेशन ऐसे भी मिलते हैं, तो उनमें ये मिलता है कि छोटे से भी हेतु से बहुत बड़ा परिणाम हो जाता है। तो इन ऐसे कारणों से हमें पता चल सकता है कि हाँ, ये इसमें पूर्व कर्म का रोल है कुछ। अगर ऐसा है तो उसमें पूर्व कर्म की चिकित्सा के लिए फिर वो दैव व्यपाश्रय चिकित्सा की आवश्यकता है। लेकिन हम, मतलब मैं तो पर्सनली उसमें एक्सपर्ट नहीं हूँ, इसलिए जो लोग उसमें एक्सपर्ट है ऐसे लोगों की सलाह लेकर दैव व्यपाश्रय चिकित्सा भी करनी चाहिए। लेकिन उसमें पेशेंट भी तैयार होना चाहिए। कभी कभी क्या होता है कि पेशेंट को लगता है कि भाई मैं डॉक्टर के पास आया हूँ, वो मुझे इस प्रकार की पूजा पाठ करने के लिए बोल रही है, कैसे डॉक्टर है। तो पेशेंट अगर रेडी है, पेशेंट समझता है, तो हम लोगों को ऐसे एक्सपर्ट्स के पास उनको भेजना चाहिए कि जो दैव व्यपाश्रय चिकित्सा जानते हैं, तो उसका भी फायदा जरूर होता है उसमें।
थैंक यू सर।
Anyone else want to ask doubt?
सर नागेंद्र सर कुछ कहना चाहते हैं, लेकिन शायद म्यूट है माइक आपका सर, आवाज नहीं आ रही आपकी।
नागेंद्र जी तो विद्वान आदमी भाई।
हाँ हाँ
आवाज ही नहीं आ रहा।
हाँ
सर आप अपने डाउट चैट बॉक्स में भी लिख सकते हैं अगर पूछना है तो।
स्टूडेंट्स को मैं
सेशन
ये एक बात, हाँ सर बताइए।
जी सर बोलिए सर।
हेलो
हाँ
हेलो
हाँ सर
हाँ
जी सर।
वैद्य उपेंद्र जी नमस्ते, डॉक्टर आलोक।
नमस्ते। हाँ
हाँ
बोलिए
सर,
बोलिए।
सीए रेक्टम में कुछ अनुभव सर, या सीए रेक्टम के केसेस में कुछ सर, कुछ केसेस ट्रीट किए ऐसे?
कौन से रेक्टम के?
सीए रेक्टम के सर।
हाँ सीए रेक्टम के केसेस में ये अनुभव मिला कि कुछ पेशेंट्स में वो साइज कम हो गया और बढ़ा नहीं, ऐसा मिला। और अभी मेरे अंडर चल रहे एक दो पेशेंट, लेकिन उसमें भी वही है कि कई बार क्या होता है कि वो अगर मुझे ये जानकारी मिली कि वो रेक्टम से 5 कम से कम कितने डिस्टेंस पे है, उसके आधार पर वो मतलब पूरा रेक्टम भी निकालना पड़ता है या सिर्फ वो सिग्मोइड कोलन वगैरह उसमें ये करना पड़ता है, ऐसा देखना पड़ता है। लेकिन सीए रेक्टम के इसमें स्पेसिफिकली बहुत ज्यादा अनुभव नहीं है मेरा। अभी मैं दूसरी बात एक कह रहा था कि मतलब स्टूडेंट्स को मैं ये बताना चाहता हूँ कि ज्यादातर हम लोग ये सुनते हैं कि जो मॉडर्न ट्रीटमेंट जो चल रहा है ऑनगोइंग, उसको सपोर्टिव हम लोग सिर्फ कुछ कर सकते हैं। तो वो तो बिल्कुल कर ही सकते हैं हम लोग, और क्वालिटी ऑफ लाइफ इंप्रूव करने के लिए हम कुछ कर सकते हैं। लेकिन जो मैंने उदाहरण स्पेसिफिकली इसलिए दिए कि जिसमें पूरी तरह से आयुर्वेद पर के आधार पर भी हम कुछ पेशेंट्स को ट्रीट कर सकते हैं। हाँ, उसमें ओवर कॉन्फिडेंस बिल्कुल नहीं होना चाहिए, और जहाँ पे हमें पता होना चाहिए कि हम क्या कर सकते हैं।